We actually did this leadership panel last year, and it was the most highly rated segment of the entire 2 days conference last year. And what we realized is that a lot of you are leaders and that you enjoy speaking with and sharing and learning from other leaders along this journey called Baldrige. So we have 4 of the most esteemed leaders with us today, and we're so thankful to have all of you. I'm going to introduce the process of how this is going to work, and then Janet Wagner has graciously accepted the opportunity to be your facilitator for this session. And how it's going to work is Janet will introduce the speakers by their backgrounds, and also each one of them will share a few minutes of thoughts with each of you about their Baldrige journey, and then it'll be your turn to ask questions for them about their journey. So Janet, I would like to bring you back up. You're obviously famous at this point, so I'll bring you back up without further ado.
Thank you, Denise. Good afternoon, everyone. Well, it's my pleasure to introduce these esteemed executives to you this afternoon, and I'm going to start with our first panelist, who is from the Southern California Permanente Medical Group and the Eureka Gold winner. So Jim Malone is the Chief Administrative Officer for Southern California Permanente Medical Group in San Diego. SCPMG is San Diego County's largest medical group with 1,100 physicians serving more than 500,000 Kaiser Permanente members, with 24 locations throughout the county. In his role as Chief Administrator Officer, Jim oversees all the SCPMG's operations in San Diego County. Prior to joining SCPMG, Jim was the Executive Director of Ambulatory Services for Kaiser Permanente in Ventura and Coquitilla counties. Before joining Kaiser Permanente in 2007, Jim served as the Chief Executive Officer of the Buenaventura Medical Group, Inc. for more than 9 years. Previously, he held executive positions with several prominent medical pharmaceutical organizations, as well as being a senior consulting manager for Arthur Andersen Company. Welcome, Jim. Our second panelist up here is Ms. Fran Butler-Cohen, Chief Executive Officer, Family Health Centers of San Diego, Eureka Silver Level winner. Fran Butler-Cohen is the CEO of Family Health Centers of San Diego, a community health center system offering services such as primary and specialty care, mental health, developmental services, dentistry, and ancillary health care. Ms. Butler-Cohen and her team of excellent managers have expanded the organization from a one-site operation with an annual budget of $800,000 to an organization with 35 sites and a budget of over $12 million. In 2013, the health center system provided over 650,000 health encounters, mostly to patients without insurance or health resources. Prior to her association with the health center, Ms. Butler-Cohen operated a rehabilitative facility for those diagnosed with traumatic brain injuries. She has a degree in psychology and an MBA. Next is Castillo de la Rocha, President of CEO Altamed Health Services, Eureka, a silver level winner. Castillo is President and CEO of Altamed Health Services Corporation and a long-standing community health leader for more than 35 years. During this time, he has taken Altamed, a non-for-profit community health clinic, from 2 employees to a fully accredited, federally qualified health center with over 1,600 employees. Today, Altamed is the largest FQHC in the state of California and among the top 5 in the nation, delivering nearly 1 million patient visits annually from more than 40 sites in the Los Angeles and Orange counties, including 28 clinic sites and 6 senior care centers. Mr. De La Rocha's dedication to and success in providing high-quality, affordable, and accessible health and human services to underserved communities has earned him national recognition in the health field, including the U.S. Surgeon General's Gold Medal Medallion for Public Health, the Pioneer for Justice Award by the Mexican American Bar Foundation, and the Community Service Award from the American Diabetes Association. Mr. De La Rocha's name was named one of the top 10 Latinos in healthcare industry by Latino Leaders magazine and one of the top 100 Latino influentials by Hispanic Business magazine in 2008. In 2012, he received the prestigious Los Angeles Business Journal Lifetime Achievement Award. AltaMed Health Services has also ranked #1 in Hispanic Business Magazine's list of top 25 not-for-profits every year since 2006. In 2013, AltaMed was named among Los Angeles' top 25 places to work by the LA News Group. Mr. De La Rochas holds a Juris Doctorate from Bolt Hall School of Law at the University of California, Berkeley, a Bachelor of Arts in Political Science from the University of California, Santa Barbara, and a Certificate in Management from the Stanford University. Our next panelist is Elizabeth Freeman, Director of VA Palo Alto Healthcare Systems, Eureka Silver Award winner. Elizabeth was appointed VA Palo Alto Healthcare System Director in 2001. Ms. Freeman's duties include overseeing one of the most complex healthcare systems in the country with an annual budget of over $826 million, more than 3,300 FTEs, and 808 operating beds. Further, she is responsible for initiating and maintaining a cooperative relationship with affiliated Stanford University School of Medicine, other local hospitals, neighboring VA healthcare systems, and the Sierra Pacific Network office at Mare Island, California. She began her VA career in 1983 as a resident engineer at the VA Medical Center in Oklahoma City, Oklahoma. She started at VA Palo Alto Healthcare System as a healthcare system administrator trainee, then moved up as the chief operating officer, VA Sierra Pacific Network office, San Francisco, California, then associate director, VA Palo Alto Healthcare Systems, and acting director, VA Palo Alto Healthcare Systems. She earned a Bachelor of Science degree from the University of Notre Dame in civil engineering in 1983 and received a master's degree in business administration from Louisiana Tech University in 1987. She is a licensed civil engineer in the state of Virginia. In addition to her VA responsibilities, she is a fellow in the American College of Healthcare Executives and serves as a formal mentor to numerous VA emerging leaders. She is a member of the California Hospital Association's Santa Clara County section and served on the 2006 Board of Directors for the Hospital Council. In 2005, she received the VA's Alumni Association's Honorary Leadership Award. She received a Presidential Rank Award as the Meritorious level in 2005 and at the Distinguished level in 2009. In 2011, she was named one of the top 100 most influential women in Silicon Valley. She completed the Brookings Institution Certificate in Public Leadership Program in 2012. So, welcome to all of our panelists. Would you like to start, Mr. Malone?
I will start. How's that?
It's perfect.
Well, they've asked us just to talk about our Baldrige journey, where it started, how, what made us decide to go on this journey. Paul, Marianne, and I, who are, it takes 3 people to be a CEO at Kaiser. It only takes 1 in other places. I don't know why it takes 3, but it does. And we came together in May, around May of 2009, and started thinking about how do we change Kaiser Permanente in San Diego. We were a new team looking at what we needed to do. We were getting awards for quality. We were getting awards for service. We were getting awards. We set a Guinness Book of World Record for every month in, I think it was 2012 or 11. And we thought, well, nothing could be that hard. I mean, setting 12 of those, 1 a month, why don't we try and go for Baldrige? We didn't even know what CAPE was. I'm going to be honest with you. We thought we were just going to go for Baldrige, and that was going to be an easy trip. And so all of us are type A's, and being type A's, you can make it happen overnight. And so we started talking about it and starting digging in, and then Mary Lynn Kels joined our team, who knew all about it and started educating us. And we went, whoa, we're in for a little more than we thought we are. And as we looked at it, we really felt that, we need to win the goal. We got to go for the goal. And that's what it's about. We always like to win and do this, and we're very competitive. And so we started our journey and quickly realized, even before our first application, it wasn't about winning the gold. It's about a lot of work. It's about changing a culture. It's about really becoming the best you can be and then even better. We even this year have said, many of you have seen the book Good to Great. Well, we changed that now. We have to go good to excellent. Great isn't good enough anymore, and we need to continue to strive. And we started really honing in on how important this is to our patients. It wasn't about us. So we stepped back and we took a look at our culture. And we had a culture which I would call a me culture. It was about the physicians. It was about the staff. It was about anybody but the patient. A little bit, Sutter gave their presentation. I was sitting in their presentation. They talked about how we felt, well, they come, we take care of them, and we're the experts, and so what more is there? Even though we were working on service, we wanted them to like us, but they still needed to do what we wanted them to do. We realized that was not the way to go, and so we started on this journey and started getting ready to fill out a CAPE application. 50 pages, that's not very much, and then it's single space and it's small type. And we started really looking at this, and we started going, well, we may be type A, but we may need to be A+ to get there. And so we started working on it, and we struggled. We started assigning our staff assignments for the different categories. They were already maxed out. They were already working hard. And so we needed to begin to look at, wait a minute, we can't look at this as additional work. This has to be embedded into what we are doing, what we do every day. And so as we assigned that out and people began to work on it and we put our first application in, we thought, well, we must have done well. We really concentrated. We've learned a lot. And so I'm sure we're going to get the goal because we were still thinking about that. And we didn't. We didn't get the goal. And we looked back and we got the first report and we went, oh, we've got some issues. And you know what? They make sense. These are things we really need to correct. And so we began then to have the aha moment that someone mentioned earlier, that you have an aha moment everywhere. And we had this aha moment that, well, okay, this is about a journey. It's about learning. And so we really wanted to hone in on what we were learning and how we were learning and how we were rolling it out, not just to our administrative executives, but then to our staff, to our physicians, and how do you bring in, it was noted that we have 8,000, we really have 9,000 employees and physicians. It's a fairly sizable organization. And so how do you roll that out? How do you communicate to all those people? How do you make sure they understand everything that you're trying to put together? And then we had another aha moment that we had our UBTs that we had, but were we really using them in the way that we needed to use them? And so we started involving the UBTs, which UBTs are unit-based teams. They're made up of our staff, some physicians, some management, and also some of our labor partners. And so we started there, and we had 134 of those teams, which is still sizable. And so we started working on how we roll that out. So that was kind of how we started on our journey. Back when we first started, one of the things that we were doing, just to give you an example, we were having this big awards dinner all the time. Unfortunately, the awards dinner was for length of service with Kaiser Permanente. And everybody wanted to stay at Kaiser Permanente because we pay well and we've got great benefits. And some of those people probably shouldn't have got an award. And we realized that, and so we eventually had to make a change. And what we did is we changed that and did away with that award ceremony and started putting in what we call a service forum in San Diego, which is very much what Sutter was talking about, an all-employee, physician, management meeting. And that was how we started kicking this off, and that was back in 2010 is when we started on that. So in a nutshell, that's our journey as much time as I have.
Fabulous.
I was taking notes as he was presenting here. We are currently at Ultimate, we're sort of in a, I think, transformational changes at Ultimate. We are implementing the Studer principles corporate-wide, organizationally-wide. We submitted a CAPE application in 2003. We're working with the Balanced Scorecard and had been working with Balanced Scorecard for a number of years. We're working with a group of professors out at USC to try to help us redesign the structure of Ultimate and sort of position us for the future. There's a lot of things that occurred in 2013 at Ultimate. In the midst of all this, perhaps the most important piece of legislation was enacted, and we got a chance to see that the impact that that piece of legislation has on Latino communities, uninsured and underinsured populations. It was being rolled out on a national level and, of course, at the state level. For us, and for me personally, working 36 years in this organization to open doors to people in need, this is a lifetime dream come true. That for a change, we now have the opportunity of insuring at a national level 35 million people. My God, I've been working for that for 36 years. We now have the opportunity of insuring people who otherwise never had access to primary healthcare services. And the problem for us at Ultimate, while we have been enormously successful, right, and I like to think of it that way, never thought that we would become a very large FQHC, or Federally Qualified Community Health Center. In fact, I can tell you the largest in the United States, 2,000 centers altogether. That was not really where I wanted to be, but we developed that way. Financially, we're hugely successful. In the last 5 years, our organization has grown in the worst recession by close to $250 million in the last 5 years. Huge success. Huge populations come to seek services at our facilities. 200,000 people on an annual basis, 1 million visits. My God, I kept saying, why can't I turn clinical outcomes, patient satisfaction, at the same level that I turn the economics of this company? We're seeing growth at 20%. How come I can't see that sort of growth in patient satisfaction? How come I don't see that kind of growth around quality? Huge challenges, even though we had invested millions of dollars on infrastructure and bringing leadership and bringing technology, communications, and building facilities. We had done a lot about brand development, but yet we cannot turn those results. So for us, a retreat that we had up in Ojai, some of you in California know where the Ojai centers are at. We had a little conference up there, took 120, 140 of the leaders of Ultimate, providers and non-providers, and I said, we need to figure out how to change this. If we're going to be competitive in this market and retain the sort of patient loyalty that we need at Ultimate, then, and if we're going to bring to our facilities that population that now is going to have access to medical services for the first time in their lives and provide good quality care, we need to improve what we are presently doing. We spent a weekend there, and I got to tell you that that was the turning point for us, where we decided to embrace Baldrige, and quite frankly, I got to thank Sharp here, because we had a visit with them back in 2010, 2011, right around that period of time. I was terribly impressed. I literally was so impressed with what I saw out there. I said, we got to replicate what we see here at Ultimate Health Services Corporation. That Ojai conference turned things for us. We embraced Baldrige. We decided that we're going to go ahead with an application. By the end of the following year, 2013, we submitted an application. We embraced Studer for the first time and developed Quint and company joined our staff at that point, and we're working with them in implementing across that organization with the use of a balanced scorecard. I got to tell you that I was, like so many of our staff, were so pleased to have been selected for a site visit. We were humbled by the fact that we had a site visit scheduled in that time. Not only was I, but my entire staff. And everywhere that you went, there was so much excitement about having the examiners come and visit with us. And we waited patiently. I know that we may, there's an opportunity for us to do that. None of us believed that we could even get close to winning a bronze or being recognized for that matter. I want to thank everyone here for your continued support. And I know that we learn not only from that one experiences, but the experiences that we have had over and over in speaking with members that are involved in CAPE here in California. Thank you very much, and thank you for opening up the doors for us. We're a long ways from finishing, and we're really excited, and we want to continue to learn. We want to continue to improve because, after all, the only reason why we're in business and why I'm in business at Ultimate, and I've been there for 36 years, I want to continue to open doors for people who otherwise do not have access to health care.
Good afternoon, everybody. So I'm Lisa Freeman. I'm the director at the Palo Alto Healthcare System, and I've been there a long time, as you heard from my resume, which was way too long. Sorry for that. And you also heard that I'm an engineer, so I love order. I speak a lot in equations. I talk about X and Y related to Z. My staff tolerate it. But those of you that heard my presentation, we had kind of a lot of events that coincided around 2009. I had some major staff changes. The nurse exec who had been at Palo Alto for many decades retired. I got to select my own nurse exec for the first time, having been there as CEO for about 6 years at that point. And I also had a new chief operating officer that joined. So 2009 was a real year of opportunity. And then I would also say another nod I would give would be to the American College of Healthcare Executives, and many times attending different programs and hearing from different Baldrige winners there. And I believe Poudre Valley might have won 2008 or thereabouts, and was very affected by their presentation. Then another thing that happened was I was asked to go to the University of Kentucky's Center for Manufacturing Lean program in the spring of 2009. I felt like I was having post-traumatic stress and back in college in an engineering lab, and this was teaching lean for manufacturing, not lean for healthcare. So all these things were kind of swirling around, and so I think I was in an executive training program, and I had a coach, and she said, well, what are you doing to onboard those new executive team members? I thought, oh, what am I doing to onboard them? And so we had started a program of doing that, and so I think for one of the first times, we talked as an executive team about, what did we really want to be as a healthcare system? Where do we want to be 5 years from now? And starting to think about legacy, and that we have a lot of resources, we have a lot of opportunity in the very privileged position that we're in serving America's heroes in Palo Alto, and all of the resources that we have. We have $2 billion in construction going on right now as well. So we had start a very deliberative decision process, which was different for me. I was used to, they talk about the shiny ball that rolls across. Oh, let's do one of those and take that on. And we actually were very deliberate about it. We brought in ASQ, and we had a bunch of opinion leaders get together, and we spent a couple of days with ASQ and sort of talking with us. We had some of the senior staff from Poudre Valley come to Palo Alto. And I believe we went through a very deliberative process of opinion leaders saying, yes, we think that the Baldrige criteria and going after the Baldrige, not the award, but just using the application process to better organize our resources made a lot of sense at that time. Now, against the advice of a lot of other people, I believe Poudre Valley was very strong about this, saying you should really only do one thing at once. We didn't do just one thing at once. So we were using the Baldrige criteria, we were looking at the magnet status criteria, and also learning more about lean in healthcare. And we've continued on that path. We've continued on that path since 2009. And I feel that over the last 4 to 5 years, we've really come to appreciate that even at this time, 5 years later, we are just getting started. We're just getting started. It is very gratifying this is our 3rd year of being recognized at the silver level by the California Center for Excellence, and we're very appreciative of that. But every time we get that feedback report, it's like, how could we have missed that? How could we have not known that? And really being more disciplined about what areas we're going to choose to improve one year to the next. It can't be all of them. We have to be more disciplined in what we're going to focus on. It's very hard for me. I think we do have a lot of type A's here, want to win, want to finish. I'm not at all sure that I've been at Palo Alto a long time. I'm not at all confident we will finish in my tenure there. But what I've come to appreciate is that the biggest gift I can give to that healthcare system is making sure that using this process that we're going to have very deeply rooted processes, systems that are going to serve the staff, serve the patients, serve the other stakeholders, serve other VAs across the country for years to come. I'm a member of lots of national groups, and I preach lean in healthcare, and I preach use of the Baldrige criteria. I've very wisely chosen to stay in Palo Alto my whole career and never go to Washington, and I never will. But more people are catching on. More VA healthcare systems are understanding that this is a tried and true system of improvement that is sustainable, spreadable, scalable. And so I'm just going to keep at it as long as I'm there.
Good afternoon. Nice to be here. What can I tell you? We were just talking. Both of us have MBAs, right? So I'm thinking, yes, statistical analysis, and we can get into all that talk, and it's kind of fun because in our organization, you heard me talk about, we have this little mantra that says, "In God we trust." Everybody else bring data, and that is the honest to God truth. If you don't have data, if you don't have the ability to measure something, then you're clearly not going to improve. And that was one of the rudest awakenings for us in our organization, is that we thought we had data before we began the Baldrige CAPE process, but we really did not have usable data. We didn't have discrete data. Discrete data is what gives you the ability to look at it and say, yes, that's what happens, and that's what makes us really change. Not just reams and reams and volumes of data. Data begets data. And I know people can get very wacky about data. I had both my babies at home with midwives. Yeah, all the women are falling on the floor here. And, it was really funny because after the second one, I'm up in the kitchen, I'm making stir fry, in the afternoon, and my husband came in and I said, I think we ought to have a third one. And he went, why would you have a third one? And I said, because, I know it's going to sound a little wacky, but I think I can beat my personal best of 3.5 hours labor. So he's looking at me like, wow, whatever. But, yeah, pretty wild, huh? So did I? No, we didn't do 3. Yeah, we didn't do 3. But, it's still kind of out there as a goal, right? So what happens when you get involved in the Baldrige process? I mean, I got on fire for that. I go and I get to be an examiner. I get trained, and you're working like a maniac because you think, like it's already been talked to you before. I mean, you think that we should be able to knock out the gold, and you start reading the book, and you go, okay, no problem, and then you get your application to review, and it's a humbling experience. Because all of a sudden, it starts to make you think about all the time and all the effort and the sweat and the pure grit that goes into this application. And you realize you've got to do right. And then you come home after the experience, and you're all fired up because you had your site survey, it went well, you learned a lot, and you start using all this vocabulary that nobody even knows anything about. And as I mentioned in our silver acceptance speech, we have 19 people in our organization that have become CAPE examiners, and to me, that's one of the most important part. So we have a cadre of people that speak the same language, that they essentially are there talking in the same way, and they know the same priorities, and they can bring their quality improvement teams in to work, or just in the workplace, we're in lean as well, into the Gemba, and we can start looking at all that as a very integral part of what we do. The other aha came from Sharp, a Baldrige Award winner, and I love this. I don't know if this hit their application, probably not, but I was sharing this with Janet earlier, is my trouble, my kind of, how do we get everybody on fire? Because, I'm a high-energy person, and I want everybody, it's almost like one of these evangelical experiences, being involved in CAPE. And then you realize that you've got a bunch of people that they're not there with you. And you're thinking, well, it must be something I'm doing wrong. So Sharp says they're cave people. Cave people, what does that mean? It's an acronym. It's called Coworkers Against Virtually Everything. Okay? And I said, amen, brother. Now I'm with you, because it's okay. You can marginalize those people. They are not going to be in the game with you, and I'm fine with that. Janet said, we don't want them working at Sutter. We don't. Get them out of here. Human resources is probably going to have very different things to say about that. But essentially, when you get on fire with a quality journey in your organization, you want as many people as you can get on that train when it leaves the station. If there are cave people out there, whatever, let them go do their thing. They're not going to be happy in your organization, because everybody's going to be talking the same language. They're all going to be engaging in the same quality improvement goal. They're all going to be on fire. They're going to be happy about the goal, and they're going to be on to the next goal. Which leads me to my story, which I think is hilarious. All 5 of us were talking after lunch, after the presentation, awards on the table. We're all leaving. And all of a sudden, someone says to us, you do want to take your award, don't you? And we laughed and we said, we are so over it. We're going for the gold. So I think that's what you have to do. It has to get into your DNA. It has to get into who you are, what you do every single day. Because that award, and it's lovely, it's really pretty.
Yes.
I like it. But that's not why we're doing what we're doing. So that's what I will share. I mean, all of our experiences sound very, very much alike, so I won't go through the whole process again. But just from our perch, that's what I think is important to share with you.
Thank you, panelists. Well, so you have heard from 4 very distinguished executives that have a tremendous amount of knowledge, experience, and most of all, Baldrige journey experience firsthand. So who's got the first tough question or discussion? Yes, yes, yes.
So I'm sure all of you have had experience in approaching and engaging physicians in this journey. I would be very interested in hearing from you what you have done that you feel is effective in that regard.
I'll start since I have a lot of them. Dr. Bernstein is sitting out here in the audience. He's the medical director. And I can tell you that if you look at it from an administrative standpoint, you really can't engage the physicians. I really believe you need a physician that understands and feels CAPE and feels the journey to help you get there. And I just going to compliment Dr. Bernstein that he had this vision of going on to Baldrige and doing Baldrige. And we've had to roll that out in our chiefs meetings. We've had to roll that out in our meetings. We have meetings with all of our physicians once a quarter. And it was in the forefront. And you always have naysayers, as you were talking about, or what was it, CAPE?
Cave.
Yeah, okay, well, yeah. And we had a few of those. But we had to have physician leaders that believed and have them really engage the leaders. And so physician to physician, I really feel is the best way to engage. As an administrator, I have the respect of the physicians, and I can do that, but it only goes so far. And I really think that if you have the physician leaders believing it and engaging, that that's the best way to get them involved.
I'll take the second turn on this. And I think that, again, coming back to our level of frustration of not being able to change some of the indicators, particularly around clinical outcomes and patient satisfaction early on. It took a bit of a crisis of bringing the leadership together and said, what are we doing and how are we going to change this? And I got to tell you that the medical leadership really stepped up to the plate and took this responsibility very personal and in fact moved very, very quickly to say we need a fundamental change in terms of how we're operating this organization. They were part of the team that traveled with us. There were a very large group of providers that were with us up in Ojai. In fact, we have 3-4 physicians that are here. In fact, one of them is Scott Kim, who, as you know, was just a recipient of Examiner of the Year, voted by those individuals that were part of that process. Dr. Martin Sirota, our Chief Medical Officer, is here as well as one of our regional medical directors, Christian Rico. They took this very, very seriously through a series of meetings that we organized with medical leadership, with all the providers, 2 meetings, if I remember correctly, involving all the providers to talk about Baldrige and to talk about Studer. It's all about engaging and involvement, and of course the all-hands meetings that are always such a delight for us to bring together. But I believe at this point that almost the entire staff of this organization is, including the providers in our organization are engaged and committed to Baldrige and to what it represents.
I'd just add briefly to what Jim was mentioning about the contact or the conversation being physician to physician. It's very important now, like Kaiser, or somewhat like Kaiser, I guess, in the VA, the physicians are employed. But we do have hundreds and hundreds of consultants who are not. They're either without compensation or otherwise consultants to us. So getting at their hearts and minds and the what's in it for them, but definitely the communication, physician to physician, what is the value in changing this process, in these processes that's going to make their clinic or their practice more efficient and add more value to the veteran.
And from my standpoint, I mean, it's easy to get a bunch of managers together that are on the same page, senior leaders, and really talk about what you want to do from a transformational standpoint. But when I found when I sat down with physicians, when I sit down with physicians to talk to them about transformational change, I have to keep in mind I'm talking to scientists. I'm not talking about somebody that's going a mile a minute and that kind of thing. I'm talking about people that approach their work very differently than senior managers. So, you just kind of zen out for a moment, and you know that discussion is going to go on a journey because they're going to ask diagnostic-type questions. Why are we going that way? What do you think it's going to do? How do you think it's going to improve? How do you think it's going to help? What's my patient going to benefit? So those are the kinds of things. Don't expect that you're going to railroad them into any kind of journey that you decide the flavor of the day, because I think that working with those individuals, I found it to be one of the absolute most rewarding parts of my work once I learned that I can approach and deal with them very differently.
So we heard from Janet this morning about an aha related to senior leaders and what are senior leaders personally doing. Jim, we just heard you talk about the me culture, and Fran talked about discrete data and people being on fire. I'm wondering, Costello or Elizabeth, where you are in your journey yet, is there any kind of, here's an aha we got out of this Baldrige process that maybe we wouldn't have had or maybe we wouldn't have had as quickly?
So I think in my time, and again, talking about working with this particular team, we've just had a change of COO left and joined another healthcare system, and just in selecting the replacement, more and more for me, it's not about me, but it's about the whole executive team and all of us coming along together. Because I don't want to be like mom and they're obeying mom because, you know, she's their mom. But it's more that if I can't talk with them and all of us come to consensus about this is the right direction to be going, and that consistency of message, that, you know, more and more we're all pulled in so many different directions and so many demands on our time, that if you aren't, my chief of staff, Dr. Leung, talks about he is all in on all of this, and that he has so drunk the Kool-Aid, and just, you know, it's not just a metaphor for the way he works as chief of staff, but for his life. And so he's all in every bit as much as I am, but, you know, if the rest of them, if they're not in it as well, it's not going to succeed, because we're addressing different people of different trainings and different backgrounds and different interests. And so that would be the aha for me. It's not about me, it's about that whole leadership team.
As I think of our own experiences at Altamed, I'm focused on a meeting that we had in August of this past year. We brought together 1,800 of the employees of Altamed Stadium, auditorium in East Los Angeles, back to our roots in East Los Angeles. And it was really to celebrate two things. Number one is to celebrate, in certain respects, the Affordable Health Care Act. Very important piece of legislation for the communities that we serve. And the theme there, it's our time. It is our time to make sure that communities in need have access to services. It was also a time that we've spoken loud and clearly to the workforce of Altamed, the entire workforce, about our journey and what it meant for our communities. I got to tell you that I have not, in the 30-some years that I've been involved with this organization, I have not seen a group of people more on fire than that group of people that was in that auditorium in East Los Angeles. And while, my God, has it been a lot of work, and I can also tell you that without a question, in 36 years, I've never worked so hard in my life. That's all of you have. That's all of you have. And the things that are important, I can also tell you that we know the progress that we are making. We can measure it. We can measure it on an ongoing basis, and feel that no question in my mind that we are clearly on the right path. And the right path is to open up more doors, to provide finest service that we can possibly can to the people in our communities. So that's really what our focus is, and I am absolutely convinced that we're on the right path at this point.
I'm sorry. Yeah, we at Kaiser in San Diego, we were really struggling with a me culture. It was more about what is my schedule from a physician standpoint, and from the employees that, well, I can't do this, or I don't want to do that, or that's not in the contract, and you know, it was just a lot of that. When we went to and brought in the service form, and I really, when I look back and see where did the me culture start to change, and I'm not even saying that it's perfect yet, because we still have some people who are still about me. But when I saw the culture change in San Diego was when we had our first service forum. And it was an extravaganza. I mean, it was just like going to a large convention. We had this, we had about 2,000 plus people in each session. We had 4 sessions. It's kind of hard to shut down a 24-hour operation, so we had to have a number of meetings, and so we had 2 a day, half-a-day sessions, and we bussed everybody in. employees and physicians. We actually, and Paul was really good at saying, physicians will ride the bus. They all wanted to drive because, they want to come in and sneak out, some of them. But he was adamant they would ride the bus because we wanted to have an experience together, and the experience began when you boarded the bus. And so they would bus them in, and we would have our meeting. And this, if you think about it, if you think about many of your healthcare workers at all levels, you talk about the EVS worker or the food service worker or someone working in the lab. Many of them have not even had the opportunity to go and hear a national speaker or to hear someone talk about service and motivational speaker. They haven't heard it, and they haven't been there. And when they went, they were like walking out just in awe. We had microphones and filming crews around, filming them as they were walking out and getting their comments, and they were so excited. Many of them would say, "I'm so excited to get back to work. I want to be able to use this," and I want, and the excitement was there. And so that was the start, but it certainly wasn't the finish because that lasted for so long, and then that wears off. And so then it was about communication, getting the word out, having forums that Paul, Marianne, and I would go out to every MOB at noon and have a town hall with everybody in the building that they would come to, and we went and we did that in all of our 20-plus buildings. We would have a communication. We would do a phone conference call where people could call in, ask questions, and we would do these kinds of things. And that started to really change the culture. So it's about a lot of little things, a lot of big things that you put together to really see that culture start to change.
Excellent. Tricia, can you wave to everybody over there? That's Trish McKay, who many of you know, but Trish has a microphone on that side of the room as well. So we have one question here, then we'll see if you have any over there.
And the first one is to the leaders, asking, how did you or how will you, as the leader, use your strengths and OFEs differently? And that's from your feedback report.
Well, I'm glad that you didn't ask 1.2.6 because I wouldn't have known the answer.
And I wouldn't be the person to ask
I'm
that.
just kidding. How will we use our strengths and our OFEs differently? That's
Yes.
the question? As I stated, when we first started on our journey, it was about winning the gold. It was about, we had this goal in mind. When we got our first report back, we realized we had to start working on our OFEs, that we had to actually pay attention to them. And some of them were a shock to us. We thought, no, we do well in that. We just didn't explain it right. And so you start to think, well, yeah, you've got to rationalize that. That wasn't us. They were wrong. And then as you really started digging into your organization, you found out they were right. And we had to really start putting teams together, and we have a team for each of the categories, and we had them start to focus on those OFEs. And they took those OFEs, and we started, first of all, having them work on them. They would bring them to what we call our ELT, which is our executive leadership team, and bring it there, and we would discuss it and figure out what we would do and how we needed to do that. Then we would roll that down, and we would start having our unit-based teams right at the staff level start working on them. And so it was an eye-opening experience that it wasn't just top-down, but we had to bring it down to our unit-based teams, and we had to have everybody in the organization working on the OFEs and trying to make them better. So that was one of the things that we did there. The strengths we celebrated. We looked at it, and of course they were right on those. And so they were right on a few things. We celebrated those, but we also learned from the strengths, and we looked at those and said, is that really as strong as it needs to be? And then we begin to wonder, well, maybe they weren't right on this one. We're a little weaker than what they thought. We really snowed them that time. I'm being facetious, really, but
you're not.
we looked at those strengths, and then we begin to dissect them and say, can we make them even better? So it was all of a sudden it became, as we looked at our strengths and we looked at our OFIs, it became about the journey. It became about how do we make ourselves a better organization? How do we open up our hearts and our minds to those examiners that came in and took their precious time to help us become a better organization? And that's the way we started. When we started looking at it like that, we got rid of our me kind of culture, and we started looking outside of that, and we started addressing it.
Thank you.
Do you have a second question?
I think it's also kind of fun, too, when you get beyond that, the OFI rationalizing the fact that, you know, it really isn't that bad, or we could have talked to them better, because we all go through this similar process. I mean, you flip through you want to know what they said bad about you. You honestly don't even care what they said good about you at first, right? In the beginning, you want to know, where do you think that we didn't come off, or we didn't educate them well enough? But I also think that our strengths, you know how the old expression goes, your strengths, I mean, it's also your greatest asset, and then, of course, you know, it's your greatest detractor. And I think that's very true. So taking those strengths, we would usually find that there's threads of those in the OFIs that we could build on. And I think it's maybe a little bit of a misnomer to do what we did in the very beginning, is to just see them as discrete pieces of data. Okay, good, check. We don't have to do any more on this one. Check, check, we're okay. Now we move on to this one. The second time we went through the process, we realized that they were a lot more integrated than we weren't just doing the check the box thing anymore, but we were really looking at it and seeing how could we facilitate the further development of both of them. Because if you're looking at the Baldrige process in the true way, those strengths aren't the end of the game. That there's always something more that you could do better. Maybe it met the criteria, but could we have a better, different relationship with the stakeholders? So it actually challenges you to take it even further.
I would just add that I think it's been mentioned in a lot of the presentations about alignment and laser-like focus. And so using both the OFIs and the strengths, and with our healthcare system priorities, and just to see, do we have good alignment? How are we communicating? How are we deploying? How are we assessing? How are we benchmarking, you know, some of the more Baldrige/CAPE ease that gets into the technical part of the application, but that's really helped us come up with that vital few, because that's where I think we still have so much improvement, that we need more discipline, because people feel overwhelmed by asking to do too many things. And I really loved Kaiser's balanced scorecard. Definitely want to try to copy and steal that.
We're sort of the new kids on the block. This is the first time we've ever submitted an application of this type, so we're still trying to figure out exactly what all those things mean. But working at it very, very hard. We do have a balanced scorecard approach, and have had for a number of years. We are engaged in Studer. But I got to tell you that as we looked at the OFIs as well as some of our core strengths, in some cases we were surprised. I never thought that we had a strength there, but it was good to get the compliment and that other people. I've been involved in this for too long, 36 years, and then maybe it was helpful to have somebody else to offer a different perspective. But I have to tell you that we are obviously taking this thing very, very, very seriously. And we know that the march to improving our performance and quality care is a very long march. I don't know whether I can get the sort of change that we need around clinical outcomes or patient satisfaction that are up at the 20-25 percentile on a per year basis, as we have done from a financial standpoint. But we're going to work very hard to make sure that whatever we do and wherever we're compared, in terms of those kind of things, from clinical outcomes and patient satisfaction, and what we do with our workforce, our employees, are at the very top of any scale. So these will help us along that process.
Okay, Trish, did you have another question? Then we have one
Thank
over
you
here.
for Yeah, one more question. Our website has a saying that says, America needs Baldrige. Do you agree? And why or why not?
I'll take that one. I'll take that one first. I got to tell you that Baldrige, to me, when I first visiting Sharp, having spent some time with them, learned about the criteria, understanding what Baldrige was about, and when I saw that it was about 45% of it was about results and getting impact, that I knew then that if I really wanted to do what our mission statement talks about, is eliminating disparities in access and clinical outcomes, that I needed something to help me along that pathway, and that was Baldrige. It is as American as can be, is providing equal access to people in need. And to me, that was the pathway that I needed. That was the instrument. That was the methodology that I needed to help me work on those issues that we refer to as healthcare disparities and are as real today as they were 30 years ago. And our focus of our corporation is the elimination of healthcare disparities, both in access as well as clinical outcomes.
I think it's very tough in a capitalistic society to overlay something like Baldrige. I really do, because we've gone so far afield, and I deal with people every day, as well as my colleagues at UltiMed, who are absolutely so beyond poverty. You cannot even envision yourself in a position like that. I was just talking to one of our physicians last week, and the woman she was trying to help, because we test for depression now in our pediatric appointments, and the woman is sitting there, a single mom with a baby in hand. All their worldly possessions are wrapped up in a cloth tied on the middle of the exam room floor. And all she needed, she's like almost beyond, just the tears are about ready to come. I just need this form signed. That's all I need. The form is for a daycare program that allows her child to go in daycare, her infant, so she can go learn keyboarding skills to get a job. That's the level that we're dealing with. So when you take the focus in our country, which has gone so beyond what's right, what's humane, what's the way to treat people, what's the way to organize business, how do you define quality, all of those things, and you say, that's over here, but really what's the most important thing is how much money did you make? How big are you? What's your net margin? You somehow lose what really is important. And to me, whether you call it Baldrige or whether you call it something else, the framework is there. And Costello is talking about the framework. You need something. So I think in that regard, yes, America does need something. We see examples of excess all the time in our country. And I think from the standpoint of how do you get back the way companies are supposed to work, these are world-class standards. And they're not, Baldrige just doesn't come out and say, you got to make a lot of money. You got to please the shareholders, because money is where it's at. They come out and they have the quality benchmarks that you need to shoot for. So yeah, in that regard, I would say, yes, Tricia, we should have a Baldrige.
I just want to add to that a little bit, because it's important as we look at Baldrige. To be honest, having gone through the journey to this part, which we know the journey isn't even over, it's really just beginning. I believe every company should be required to take and be in Baldrige, to be honest. I say that because in healthcare sometimes, as you've just heard, we process people. And if it's about just the process, then we're losing something. And I do believe that Baldrige and the CAPE Award and everything we've been going through, even though it is structured and it seems to be processed, it's more than that. It's really getting to where our hearts and minds are, and that's what we have to do. And we have a saying at Kaiser in San Diego, you have to see it, you have to own it, and you have to do it. And if you don't see it, own it, and do it, then you really shouldn't be working there. because I think someone mentioned today, it might have been in the Sutter meeting, they talked about just picking up, or I think it was you, picking up a piece of trash on the floor. It's being able to take responsibility and own why you're in healthcare. If everybody stopped and just looked at why we went into healthcare to start with, every healthcare organization at least would be on a Baldrige journey. So I would say yes as well.
You know, I'm going to weigh in on this one too a little
please.
bit, because this question is a little bit frustrating for me, because I think more people need to hear about Baldrige. I get disappointed when I talk to people and they've never heard of it. But the other thing that's disappointing to me is how many organizations out there confuse tools with a framework. And they think they're buying a tool like Six Sigma or Lean, and they want to call it an operating system. It's not going to get them to where the Baldrige framework is going to get them. And all too often, organizations go down that path with a tool. And that tool is not going to be the answer for everything. So that is a big frustrator for me, that people don't see the difference between using tools appropriately and using a framework that may last many, many years longer for them.
All good comments. Okay, our next question is over here.
Yeah, if you could speak to any challenges that you may have faced bringing your client-facing personnel and your operations group in this journey. Ultimately, in our agency, we believe it's about one mission. But what challenges did you face bringing your administrative groups with your clinical groups, and how did you bring alignment and incorporate them into this process?
So part of what I was talking about with in my presentation about our service improvement model, and talking about what's the way that we do business at the Palo Alto healthcare system, and it has 3 components, and one of those are the value streams. And not to talk about value streams, but just I think it resonated so well with staff of hearing from leadership that no more us versus them. It's all about team, and that everybody's supporting each other in the team. And then that's been another way we've underscored that is with our customer service model. All of these things, I think, in using the Baldrige framework, being able to bring different initiatives under a common umbrella and have that connectedness and that participation of people from all different stripes, whether it's through some of the methods of Lean, but it's really this overarching framework of continuous improvement and being veteran-centric.
Wonderful, thank you. Any other questions from the audience at all? Yes, John.
There's been several VA groups that...
John, could you stand up? We can't hear you.
It's the phone, yeah. There's been several veterans groups that come through here, and we know that it's funded by the government, and they all seem to have some kind of regimen or some kind of a criteria that they use as an improvement type of thing. And what is their reaction, to someone like the CEO is saying we want to use Baldrige now as part of our improvement process?
Well, I don't know if you're referring to the VA has its own version of the CAPE award, the CARE award, and they use the Baldrige criteria?
Yeah, well, there's certain types of improvement processes that the government uses across the board, for VAs and other government facilities like military or something like that. They have.
So another one of my soapboxes in the Veterans Health Administration is to declare a continuous improvement methodology. So they came up with something that just trips off the tongue called VA TAMIX, Vision Analysis, Team Aim, Match, Map, Measure, Change, Sustain. Easy to remember. Right. So, and even that was optional. It's optional. It's a tool. You can use it if you wish. And it's like, So we are about to get a new undersecretary. We have a new chief officer for quality, safety, and value, Dr. Carolyn Clancy, who's come from AHQ, and she is really going to, I think, have a big influence on the next new undersecretary. And I'm really pushing that they use, a lot of vision directors do use Baldrige criteria as the guiding principle in their vision, and to just declare that and get on with it. That's my hope, that that's what will happen in the near future, at least in the Department of Veterans Affairs.
One thing I want to add to the last question over there, and I would be really remiss if I walked away and didn't talk about this, is I would say one of the best things that we do as a total management team is we have fun together, fun. So you'll find that these criteria spill over into those areas. And, you know, picture me out there paintballing, you know. And the whole team went paintballing, you know, the whole senior management team. We're just knocking each other, you know. I mean, it felt so good. And there's criteria 2.1. Didn't get that, did you? So there was so much energy around that, and Janet with her turtle, and these are the kinds of things that I think you have to just make it fun. I mean, Mike Murphy, if anyone knows Mike Murphy, CEO of Sharp Hospital, you know, he dons a Superman costume in his all-employee meeting, you know, when he comes in there, you know, like Reeves flying in the room. And so I think sometimes maybe that's not what you want to do as the leader or the CEO or the quality improvement director, but you got to get out there and make yourself relate to your employees, not so much on their level, but so they can see that you're a human being and what you're asking them to do is totally possible. It is completely, utterly possible. When you first talk about, can you do it? People are going to say, oh, no, I don't know, Fran. We got so much on our plate. You know, we got all these projects over here. With joint commissions coming up, that kind of thing. But I think if you bring it down a notch from discomfort to pure D fun, then I think it's really going to help with the culture change. Mm-hmm.
Did you have a comment?
No.
Okay.
I didn't.
Any other questions from anyone in the audience? Okay, ladies and gentlemen, can we please give Janet and the panelists a round of applause? Thank you, everyone. But the most important thing I have to say is we hope to see you again next year. And also I'd like to thank my staff. Trish McKay, where did you go? Well, she's probably working. There she is, waving over there. And also Megan O'Keefe. Yeah, she's over there. Hi. And I would also like to say that if when you leave, the parking is reduced if you tell them you're with CCE. And we have a very important announcement. Last year we held an event at Soka University that was called our Leadership Symposium. And it was all, in fact, Janet's going to be one of the speakers. We have some high-level executives, 4 national Baldrige leaders, president CEOs coming. And it's going to be on June 4th. And it was the most highly rated conference we've ever had. I'm done. So I would just like to make sure that you put that on your calendar. We'll be sending you information about that. Janet, thank you and your team for being here. Everyone, congratulations to all the award winners. Have a great year. We'll see you next year. Thank you all.